We are live.
Okay, well, I'd like to call this meeting of the Health and Wellness Advisory together for this Wednesday, March 3rd, 2021. So can't believe we're already into March. It's starting to move into springtime, although it's cold and rainy this morning. We're starting to have some warmer temperatures and some better times and having some positive news come back. So that's all great. I did want to start off by letting you know that we did make a report to City Council for the Health and Wellness Advisory Committee, and City Council was very pleased with what we've reported back to them, and they're very supportive of this group, and certainly want me to relay back, you know, the appreciation of the city for the time and expertise that this council gives to, or this committee gives back to our council. It's very, very appreciated, and they were very much in favor of the heat watch that we had, that we brought before them. You know, that was supported unanimously, and they're very appreciative of the work that we've done on that as well. So with that, I think I'm going to let Paul start us off with a city report.
I'll just talk mainly about vaccines. Well, first I'll say that we're seeing a drop in our employees with dealing with COVID cases. So that's maybe hopefully a sign for our community. Although I think I saw some we had like 37, I think, people in Charleston County get infected yesterday. So, but I'm not going to. That's where I'm going to let Katie talk about that part of it. But the two good things on the horizon is that we've got two groups that will be doing vaccines in Charleston in the coming, one starting next week. We can't say enough about federal healthcare. They have been working in our rural communities. They're out at Watermill all today, and they will be at the city gym, Arthur Christopher Community Center, next Wednesday from 9 to 2, doing their free clinic. And I think they hope to do, I think it's around 500, but anyways, they will have people standing in line waiting to do the vaccine. So that's a good thing for us coming up very shortly. And then on the 15th, if everything goes according to plans and the vaccines arrive, the city has entered a contract to join in partnering with MUSC to be able to do, our OD&B facility there by the courts and by the police department will be opening to the public for vaccinations. And that is not a one-time affair. That is hopefully a 9 to 12 month, but I don't think there's a determination of how long it will be, but it will be on a more open opportunity to get vaccinations into our downtown Charleston. And that, at least it looks like it's going to be a 6-day-a-week operation. So we're excited about that. And that's our big news. I know, I don't know if Mayor or Councilmember Seekins or Shealy wanted to add anything on from the city side.
What did you say our big news was? I'm sorry, I just signed in.
Well, that we had two opportunities with federal health care next week and with the DMV following that.
Oh, right. Great. Awesome. Got it.
And,
thank you.
And then moving to 2A, 1B is exciting for the opportunity of what it's going to do for our community as well, too.
Absolutely.
So, well, with that, Susan Johnson was supposed to be on our agenda, but Kevin, she is running a little late. So if we could maybe jump in and go ahead and let Dr. Richardson jump in and start with us.
Yeah, that'll be great. Thank you, Dr. Richardson. Thank you, Paul.
Absolutely. So I usually leave the statistics to Tracy, and I see she's not on today. So just briefly, I'll say that we are coming up on our 1-year anniversary of our first case of COVID diagnosed in South Carolina. That was March 6th of last year. And since that time, we've diagnosed over 518,823 confirmed and probable cases in South Carolina. And of these, 8,576 of our residents have died. And just nationwide, to sort of put that those numbers in perspective, with over 516,000 deaths, that is more lives than all the Americans lost in World War I, World War II, and the Vietnam War combined. So although we are seeing light at the end of the tunnel, especially around this time of the anniversary, we do want to remember those who have lost their lives to this infection and all that it has taken from our community. But on a more positive note, yesterday across the state, we only had 592 confirmed cases, and Paul already talked about how many were in Charleston. Only 13 confirmed deaths, and 4.6% of individuals testing positive. So someone on an emergency manager call last week sort of asked me what data are we sort of looking at sort of for the end game. And we discussed that, and I think it won't be any surprise to those on the call, but I think it will be a combination of case rates, so incidence of new infections, percent positivity, the percent of our population that is vaccinated, and then the sero survey. So sort of trying to figure out, we've got to factor in how many people have been infected but don't know that they were infected. And that comes from the seroprevalence surveys, some of which are being done through commercial labs. South Carolina's doing a specific one called SC Strong, and more increasingly coming, which sort of look at antibodies as well as PCRs and antigens to try to find those folks. So, we believe now herd immunity will likely come when somewhere between 80% of the population is immune either through infections or vaccination, but there are just still so many factors that contribute to that about how long immunity lasts from both of those, but especially from infections, as well as the variants and their sort of move into our communities and how much more transmissible they will be, and the effect, therefore, that we will see from increased infections and therefore hospitalizations and deaths from there. We do have a map now on variants on our DHEC website. I think it'll be updated soon. It will show that we have 8 identified cases of the South African variant and 2 identified cases of the British variant in the Low Country region, but we know that's very much an underestimate because we're still only doing whole genomic sequencing on a very small portion of our positive cases. That being said, we do want to, in particular, highlight to providers that if a case is diagnosed that meets the definition of a vaccine breakthrough case, so someone who's fully vaccinated, it's been at least 2 weeks since that second dose, and they've had no positive in the past 45 days, then we do want to hear about that case, and we would like to try to obtain any residual specimen to send to our public health lab for sequencing. Moving on to the vaccines, which is probably the brightest star in what's going on with COVID these days. We're now at nearly 2 million doses per day across the United States. And yesterday, President Biden announced that there should be enough vaccine by the end of May for all adults in the United States, which is several months earlier than we had previously believed. South Carolina also hit the good milestone that we've given more than 1 million doses of the vaccine this week. As of yesterday, it was 1,003,558 Pfizer and Moderna first and second doses given. The CDC estimates that we now provide about 14.5% of the population with at least one dose, and 6.8% with both doses, with 83% of doses being administered. I know Tracy, who's now on, and others have asked about the differences in the data on the CDC website and the DHEC website about how many doses have come to South Carolina and how many have been given. And I didn't bring the exact numbers. I did send those to Tracy, but it's basically the CDC puts the number that they've promised South Carolina. So it's usually up to sort of 3 weeks ahead to allow us some planning. And so they include those numbers in what they report, even though DHEC only includes numbers for vaccines that are actually on South Carolina soil. So only those who have actually come here. And so we believe that the numbers, given that difference, given some delay in reporting, are actually basically the same. They're just reporting different things, but I'm happy to go into more detail on that with anyone who is interested. We have begun piloting a program to get vaccine to our homebound population. That's happening in 2 rural counties in the Low Country to start off, but we hope to expand that soon. And that's a partnership right now with Agape, which is a hospice organization. Hopefully today, and I know Mayor Tecklenburg and Tracy will be happy to hear this, I believe the DHEC will debut a new version of our vaccine dashboard that will better refine data by county, and even I think I've heard by zip code level, as far as who has gotten vaccines, some of the demographics associated with those groups, so that we can better plan on and work towards ensuring equitable access and distribution of our vaccine. As of now, we're still in phase 1A of vaccine distribution, but yesterday, Governor McMaster did report that we will move to 1B on Monday. So that's March the 8th. And that group will include the following. It'll include anyone age 55 and over, anyone with increased risk of severe COVID disease that are age 16 to 54, but also have chronic kidney disease, chronic lung disease, diabetes, Down syndrome, heart disease, HIV, solid organ transplant, obesity, which is considered a BMI of greater than 30 for these purposes, pregnancy or sickle cell disease, also those with developmental or other severe high-risk disabilities. It will include the frontline workers with increased occupational risks, so those who are working in person and who through their position are unable to socially distance from others. So unable to stay more than 6 feet away for 15 minutes from others. So we really are defining that as occupational risk that is above the risk of the general population. In addition, there's individuals at increased risk in settings where people are living and working in close contact. That will be workers and residents in homeless shelters, in correctional facilities, in group homes, migrant farm workers who live together or share transportation. Will include anyone working in healthcare or community health that has not already been vaccinated in 1A. And then, so that's really combined sort of many of those that we were talking about in both phase 1B and 1C previously. So 1C that we anticipate opening up around mid-April, so around April the 12th, will include people 45 years of age and over, essential workers who are not included in 1B. And then finally, we hope to begin phase 2, which is all other South Carolinians age 16 and over on May the 3rd. And then our best estimate for, this is not DHAC's best estimate, but this is best estimate that I've seen in the literature, looking at the phase 3 trials, all trials on kids younger than 16, is that likely it will be the fall for older kids age 12 and over, and late 2021 or early 2022 for those younger than that. So people can make appointments the same way they have been, either through our Vax locator, which shows in green, who has available appointments open right now, or there is a DHAC vaccine line that is available to help those without internet access. Eligibility, there was a lot of talk back and forth about how people would be able to prove they were eligible for vaccinations. We are going to rely on people's word for that. We do not want to decrease access based on needing a letter from an employer or certain badges that say what their work is. We will ask for an ID to confirm age for those that fall in that category. And then we will also take people's word on their medical conditions. So all that being said, we are still asking the population not to cut the line, so to speak, because we still want to prioritize decreasing deaths, primarily in hospitalizations in our state. And we continue to say how many, 82%, I think, of our population's deaths have been in those 65 and over. Now, I believe it's 94% who are in those 55 and over. And also around 65% did have another medical condition. So by prioritizing those groups in 1B prior to moving on to the greater population, we hope to continue to decrease COVID-related deaths in our state. I just want to finish by saying another bit of good news is that Johnson & Johnson did receive emergency authorization this past weekend for their vaccine from the FDA. This vaccine uses an adenovirus vector to deliver spike protein DNA, and phase 3 trials showed about 72% overall effectiveness in the US for preventing moderate or severe disease. It is a single dose, which is a huge advantage. It also does not require being frozen as Pfizer and Moderna do, which will be another huge advantage. It's around 86% efficacious in preventing severe disease. And even in South Africa, where the South African variant is predominant, it was about 82% effective. And there were no deaths in the vaccine group. We also see a significant reduction in symptomatic infection overall. And so that's certainly a good sign that perhaps, hopefully, there will also be reduced transmission, not only reduced symptomatic infection, but reduced transmission with this vaccine. What else do I want to say about? We're getting about 41,000 doses of Johnson & Johnson vaccine this week into South Carolina. They've promised a total of about 20 million doses by the end of March. And we heard just yesterday that Merck is going to assist Johnson & Johnson in manufacturing that vaccine so that more will be available sooner. So this is the third vaccine now authorized in the US. It joins Pfizer and Moderna that I've spoken of before. Those are mRNA vaccines that have been available since December. AstraZeneca and Novavax are two other vaccines that are still completing phase 3 trials, but may apply for emergency authorization later this spring. So they all work similarly in that they target the spike protein and they just deliver it using different platforms. And so I think the message that we want to get out now that we have 3 options, and really, even if we have these additional 2 options, is that all 5 of these vaccines have been shown to drastically reduce hospitalizations and prevent deaths. And one statistic Dr. Kelly, our assistant epidemiologist, likes to use is that 75,000 Americans have participated in trials for one of these 5 vaccines, with 0 deaths reported in those trials due to the vaccine or due to COVID after being vaccinated. And when we compare that to 75,000 Americans with COVID, that has resulted, those infections have resulted in approximately 150 deaths and several hundred more hospitalized. So our key messages are really, please get whatever vaccine is available to you first. Having the vaccine, any of these vaccines is protective and will help us to move towards herd immunity. So it's not only protective for you, but for your friends and family and the community at large. That all available vaccines have been proven effective at preventing serious illness, hospitalizations, and deaths. And so that we hope that all will take advantage of the vaccine that is available to them. That being said, until enough of us get vaccinated, we must all continue to wear masks, to stay 6 feet away from others, and avoid crowds, even after we have received the vaccine. Also, being tested can continue to help reduce the spread of disease and identify the presence of variants as early as possible. So ultimately, we believe that we have a small window of opportunity now to take advantage of the decreasing number of cases and continue with the public health measures we have in place, and then vaccinate as many people as possible. So I think I'll stop there, and I'm happy to take any questions.
Thank you, Dr. Richardson. I have a question for the 1Bs. Should they wait until Monday to schedule the appointment, or can they schedule now to have an appointment after March 8th?
Well, so the official guidance is wait until March 8th to schedule. That gives those in phase 1A a few more days to know that soon there'll be many more people who are eligible for the vaccine. That being said, I've certainly heard from a number of people that some providers have begun scheduling for phase 1B. So if you do call and are able to schedule an appointment, we're leaving that up to the vaccine providers themselves as to when they want to open up scheduling for phase 1B.
Okay, great. Any other questions for Dr. Richardson?
Joey had a question.
Oh, sorry, Joe. Yeah, go ahead.
That's okay. Yeah, I put it in the chat, but Dr. Richardson, I've had lots of conversations with community groups in the area, and I continue to hear the question around whether or not folks who have already gotten COVID and recovered, is there still an elevated need for those individuals to get vaccinated?
Absolutely. There is still it's not a caveat, but we do still ask that consideration be given for those individuals who've had COVID within the last 90 days to consider delaying that vaccine for about 90 days, as long as demand exceeds supply for the vaccine. We do still have great confidence that those who have been infected with COVID do have immunity to the infection for at least 90 days. And we believe it's probably longer than that. And so this just allows us to reach herd immunity faster by ensuring that those who don't know that they've been infected or haven't been infected to get the vaccine. But we do want to make sure that those who have had the infection do get vaccinated. We believe that that is going to provide better long-term immunity to the infection. And it's not a contraindication for getting the vaccine earlier. There's some evidence that perhaps side effects immediately after the vaccines may be slightly higher, but other than that, it's not a risk to the person receiving the vaccine to receive it sooner. So I just got a question today about teachers that, if there's a vaccine event at a school, must the teachers wait that 90 days? And the answer to that is no. If it's convenient, if they feel like that's the right thing to do to move forward, then they may get it at that point in time. But if you're working to find an appointment, certainly you can give it some time and wait till closer to that 90 days to make that appointment. Did that answer your question, Joey?
Yes, thank you so much.
Yeah.
Mayor Tecklenburg.
Dr. Richardson, thank you for that informative report and very positive looking forward with all the news about vaccinations. A couple of quick ones, and maybe I just missed it, but did the teachers and all teachers end up getting included in the new group?
Yeah, so phase 1B, because teachers are working in schools, or if not, we hope that those districts that are not yet in person will soon be. They are all included in phase 1B because they're not able, they do have, we believe, greater risk than the general population because of the number of students and staff that they are around at school. So all teachers and staff at schools, daycares, colleges and universities are included in that number.
Great. And, come Monday, I think we'll clearly be in a situation where the availability of doses will be the limiting factor on getting folks vaccinated because you're opening up the availability, so to speak. Just curious, and this might be a discussion for when this is all over, but someone told me that even from the very beginning of distribution, that per capita, South Carolina was way down on the list in terms of number of doses we were receiving. Is that true? And are we getting a little better percentage or per capita number of doses now? Do you know?
Well, so this is a question that has come up often, and the response from the immunization program in Columbia is that much of that difference has to do with the vaccine set aside for the long-term care facilities. And we're beginning to pull some, so we set aside sort of all doses that we thought would be necessary for residents and staff at long-term care facilities. And as we know, in any given population, it's unlikely that 100% of those eligible will choose to take the vaccine. But we wanted to make sure that it was there. As now most of these facilities have had 2 visits. So many have had 2 doses and the 3rd visit is being planned, if not has already happened, to sort of make sure that everyone gets both doses. We are sort of pulling some of that vaccine back into our general sort of state supply. So the federal government certainly says, we're providing equitable distribution. And the reason that it looks that way is because of the sort of the way that we distributed that vaccine initially. So that's my understanding. And the immunization program has been pretty consistent in reporting that, where everyone is getting increased supply, both because of Johnson & Johnson now, but also Pfizer and Moderna are increasing their manufacturing. And so, right, I don't, it will certainly be some, there may still be more demand than there is supply of vaccine, but we're working hard to increase the number of vaccine providers to help accommodate, that increased number of doses and be able to continue to get them out at the similar percentages, somewhere between 80 and 85% of doses coming in that we get out within, the week to the population.
Thank you for all you're doing. Incredible. Thank you.
Okay, Paul?
Kevin, I was talking about what we were doing in the city, a couple of the good things, and I failed to say one of the best things that I think is what Laurie and her staff will be doing in recreation with the education part of trying to help people register. And Laurie, do you want to just touch on that?
Sure, Paul, thank you. So looking at the fact that we've got some buildings that have computer labs and internet access that might be near some of our underserved communities, we have gotten the ability to train our staff to help residents walk in and register using a city computer and our internet for a vaccination. And so those facilities, there's one on James Island in the Westchester community. In West Ashley, we're doing it at Forest Park Playground, which is in the West Oak neighborhood. And then we've got 5 sites downtown. And so we're very excited about that. We're hoping that some of the folks that live in nearby housing or some residents that use our facilities will feel comfortable coming in and letting a staff person walk them through, or even helping them just sit down and do the vaccination registration. So we think that's another layer of the city trying to work with our residents closely.
That is great news. I've not heard that before. I'm really excited to hear it. And from what I've heard from the Feder partnership with the Charleston County Public Libraries, that has been a huge benefit to have library staff assist residents in the days prior to the clinic with their, at that point, it's really with their paperwork. But I think that is a wonderful model to help increase access, in particular with our more underserved communities.
Laurie, that is great. How are we getting the word to those people that we have the assistance there?
So we were all ready to pull the trigger 2 or 3 times, but the vaccine availability has really kind of hurt us. So right now we're working with the PIO office and all of the means, Mike Wack and his church leaders. Paul set up a great phone call last week with Federer, and we all kind of exchanged some information. So we're ready to pull the trigger. We just need to make sure that there's enough vaccine available for folks to actually come in and register for it.
That's great. Thank you for all of that. Great work.
Can I just piggyback one thing onto what Dr. Richardson was talking about from a pediatric perspective? We continue to see children come in waves with the MISC, or the multi-system inflammatory syndrome in children, which is a sequela of a COVID infection. And I was just on service last week, and there certainly are children coming in quite ill with this. And so we're just trying to increase the public awareness of this, really for pediatric providers, but for caregivers of children with fevers. They need to be thinking about this and seek care from their pediatrician. And then providers in the community can always call MUSC and ask for the pediatric infectious disease doctor on call, and they are more than happy to assist in trying to triage these cases and get the kids the care that they need.
Great, thank you. All right, and Tracy, Paul had given a kind of a city report earlier. We was talking about MUSC, the DMV and Federer and all that. I didn't know if you had anything to add at this point. So.
Nothing really, but just to get it on the record, if you will, at the city zip code level, I mean, our cases continue to decrease, which is very encouraging. And so hopefully with, the number of doses of vaccine coming into the state on the rise, hopefully we're going to continue down this path. So.
Great. Very good. And Maggie, not to put you on the spot, I just didn't know if you had anything from Charleston County Schools.
Sure. Really exciting day yesterday. As we've shared in previous board meetings, we do have an operational plan for vaccine distribution. Once that becomes available to us, we have, if it's a large number of doses that we receive, we have 4 sites. If it's smaller, we have 2 smaller satellite sites, and we would just simply, scale it as appropriate, depending on how many we get across how many days and in what quantity. But our nurses will be administering the shots. And, we're just really excited in general. So that's kind of the big buzz going on with us. Last time, or I guess that was a call earlier this week. We continued with our athletics operating, our spring sports. I do believe we too are seeing lower case numbers. So that's exciting. On our dashboard, that information is updated daily. And in general, I just think we have about 75% of our students in person. So, as we rolled into the second semester in the beginning of February or middle of February, we saw a bump up in those students returning in person. So that's exciting as well.
Great. Thank you very much. All right. So we kind of shifted our agenda a little bit. Paul, I guess if it's all right with you, we'll go to Dr. Susan Johnson with the Health and All Policies update.
That's fine. I did want Tracy, if she would, just talk us, but we have, we've been doing our dashboard of our where we are with all our percentages and all. And Tracy had good news yesterday, so I thought she might want to share that real quick.
Well, just related to our cases have been going down for 4 or 5 weeks now, and so our dashboard indicators are all green at this moment. It's very encouraging.
Very good. Thank you. All right. With that, Dr. Johnson, I'll call on you now.
Sure. Thank you for being flexible with the agenda. I apologize for being late. So Paul asked me to provide an update to the committee about our health and all policies work. And so I wanted to share with all of you that we convened our first work group meeting. And really, it was not an official meeting because we are still trying to wrap our heads around, what it is that we're trying to accomplish and the structure of this team, whether it should be a subcommittee or just a work group, and that's open for discussion. But I just wanted to share with you, let's see, I'm looking at my notes. So we met on Thursday, February 25th at 8:30 a.m. It was a virtual Zoom meeting. In attendance, myself, Paul Wieters, Mike Seekings, Katie Richardson, Meredith Berlinski, and Joey Current. We first reviewed the presentation that I presented to City Council. I believe that was in January, and that was approved. It was basically an approval of a motion that we engage in the health and all policies framework within the context of the city plan. And so we reviewed that, and then I asked Paul and Mike to provide an overview of the comprehensive plan for the city of Charleston. And so we talked quite a bit about that because we really didn't understand what that was or what the process was. So that was really informative. As we understand it, the planning department is charged with building this 10-year plan. It is a requirement for all cities. And I believe we've been given an extension. We're a little behind, but due to COVID and some other challenges. And then as well, we discussed the fact that we, since Jacob has left, and as I understand it, our new city planner hasn't yet started, or maybe he just did, but we didn't want to jump on him immediately. We needed to have a strategy for how to engage with this team. And so we talked quite a bit about kind of what next steps were and who we needed to engage. So I believe Paul did have a meeting with Christopher Morgan to talk about how we can engage with the city planning group that is charged with this comprehensive plan. We also discussed that we think it would be very valuable for us to engage in the public engagement meetings. As we understand it, we've already missed one or maybe two. So we're going to try and do some catch up there, because we think that it's really that will provide some great insight for us into what the community believes are priorities. And then we talked about other folks from the city and from the community that we want to involve. And that would include our Chief Resilience Officer, Mark Wilbert, Amber Johnson, and to make sure that we're addressing the equity and diversity issue. We wanted to make sure for our work group that we had representation. So I know that Dr. Richardson has reached out to Feder to determine who the best representative would be from that organization. Lori Yarborough, your name came up since you're such a rock star. So I don't know if anyone has officially reached out to you, but we really would like for you to be a part of this group as well. So we have not yet set a date for our next meeting. We just had some kind of groundwork that we needed to do before we planned our next meeting. And for those of you who maybe, I don't remember if I presented to this group. I know I shared the presentation that we presented to City Council, but just kind of a reminder that the goal of this Health in All policies is to create system level changes within city departments and the community to address inequities at all levels to eliminate health disparities. And it really focuses on the social determinants of health. And so I'm happy to answer any questions, or Paul, if you or Mike want to provide an update on, or Katie, on kind of the background work since our last meeting and next steps.
Well, I'll just jump in real quick. I did talk to Laurie, and she is excited about being a part of it. And I talked to Christopher Morgan over at the planning division. It's interesting when they are doing this plan that's mandated by the state. They have so many requirements on them that come in, and really, when I talked to Chris, it really was seeing, you know, the biggest part that the city gets out of this is the land use part of how they're going to develop the land from there going forth. But I asked Chris and them to, Christopher, if they would present with us and the committee shortly, just to explain how they're doing it, because that's where Christopher felt like most of anything that we do with health is related to land use. How are we looking at transportation? How are we looking at all of those being in design in any development? And I did emphasize to him that it's not just looking at what policies are, it's looking at how are we really looking at affecting and changing that health in those communities. It was interesting, yesterday I was on a Zoom call for Benefit Focus, and I was listening to Dr. Benjamin, who was the 18th Surgeon General, and she was talking about how looking at a neighborhood and looking at how we try to get everyone to get a high school graduation, because if we get just getting a high school graduation immediately increases the life expectancy. And it also gives them good knowledge for knowing to deal with healthcare. And it also gives us a wonderful opportunity to encourage them to go into healthcare and do other things. So there's just so many things of how we look at it in our planning, our zoning, our policies of just making little simple changes of what the difference can do is. And then there was another quote that came out of that is health is in everything we do, not just about managing health, but being responsible for improving it. And just everything that you talked about in that little key point is what somehow we have to figure out. How do we ingrain that in our policy making? Just as how are we going to change that health? And I hope that when we meet with Chris and Christopher and all, we can get them to think about how is a simple sentence that could be put into that plan that says we've got to look at how is one building going to change health in our community to do things. So
Yeah, that's a good point, Paul. And I want to emphasize that even though it's called health in all policies, that we don't want to get stuck on the policies piece of it, because it really also addresses how services, resources are developed, prioritized, and delivered. And so it's not always going to be an official policy that we are impacting, but it's decision-making at all levels.
Okay, anyone else?
Hey, Paul, I'll add that as we're coming together for the end of the Parks and Recreation Master Plan, which I know everyone's anxious to get this finished, we have been working for the last couple weeks on our mission and vision statements, coming in with all the other information that the consultants have gathered during the last 9 or 10 months. But I thought it was real important. Our number one goal and objective is the health and wellness for all residents with our Parks and Rec Master Plan. So I thought y'all would be happy that we did keep the word health and wellness in as the number one goal. Obviously, we have a number of goals that we're focusing on, but I think it's real important for Parks and Recreation to continue to remember that health should be our number one goal. So I was happy that we kept that there.
All right, anyone else? I think, although we've moved the agenda around, I think we've hit all 5 items of the agenda, haven't we, Paul?
Oh, I did want to speak briefly about the U=U if there's nothing else on the agenda.
Okay, great.
and Jennifer Roberts had something she would like to add into.
Okay.
Mine is quick, I think. So it's just a quick update about our Tri-County SHAPE initiative and our Fast Track Cities initiative that is trying to end the HIV epidemic in the city of Charleston and in South Carolina as a whole. And we just wanted to let this group know that the Tri-County SHAPE initiative has officially joined the U=U movement, which is formerly known as the Undetectable Equals Untransmittable Prevention Access Campaign. Over 1,000 other organizations based throughout 120 countries have signed on to this consensus statement, which really aims to address stigma around living with HIV in order to help bring more to testing opportunities and really involve those living with HIV in ending the epidemic and sort of destigmatizing the infection. We hope will go a long way towards doing that. So really what it means is that those living with HIV who have undetectable viral loads due to treatment, due to medications that are taken regularly for their HIV infection are not able to transmit that infection to others. And so we'll be working in the near future to determine how best to sort of present that message to our community. And then we continue on a sort of related but separate matter to work towards developing a way to bring more people living with HIV and at high risk for contracting HIV to the table, potentially as community health workers, to help to galvanize those groups to assist us in developing the sort of ending the epidemics plan for ending the HIV epidemic, as well as on a more sort of individual level to assist in ensuring that those at risk do get regularly tested, and those who know they are infected are linked or relinked to care if they've dropped out of care, and then are able to maintain that undetectable viral load with consistent medical care. So I sent the sort of official letter to Paul. He'll send it out with the minutes. Thank you, Paul. And more to come on those fronts soon. Thanks.
Mayor Tecklenburg.
So if I may add a little recent notice we got, I think just in the last day or two from HUD regarding our Cdbg and Opwa funding. It was interesting that Cdbg funds were about the same, but there was a reasonable little increase in the Opwa funds. That's what we dedicate to our AIDS community organizations. So I was just thinking that if there's some particular initiative for the fast track initiative that needed attention or a little bit of funding, we might be able to accommodate that.
Wonderful. I'll bring that back to the group, and we'll get back to you shortly with some ideas. Thank you.
Check with Gianna, or we can, Paul can check and get it to you as to what the delta is. But we did see a little increase in funding for this year.
Great. That's great news. Thank you.
All right. Well, thank you again. Jennifer Roberts.
Good morning, everybody. I just had two updates. One is just a reminder about our SC Hopes line, where we have people can call. It's based on healthcare workers and anybody who's kind of been affected by COVID or symptoms might have increased because of COVID, which is a lot of people. We have funding to help pay for services. We can help connect people to services. We can also help people coming out of jail get 30 days of medications paid. So it's kind of, but it's for mental health and alcohol and drug treatment. And so I asked Paul, like I ask almost every month, to send the flyer out to everybody again for SC Hopes. We've gotten this grant extended till I think June of 2022. So these services and assistance will be out there for a while for people. So I just want to remind people about that. The number is 1-844 SC Hopes. And my other news is kind of exciting and different. So for the past probably 8 years, we have been involved with the Piccolo Spoleto Festival and had Art of Recovery, which has been an art exhibit for artwork from mental health patients from around the state, where we sell the art. We also provide resource information, but the patients actually we always sold the pieces and they got all the money, and it ran the entire time. I think it usually end of May through early June at the Circular Church downtown. But due to COVID this year, we've been having issues with, a lot of patients aren't coming into the centers across the state. They're doing telehealth instead. So we kind of ran into a problem of getting art from the adults. So NAMI came to us and said, I have an idea, and we've kind of run with that. And so we are going to this year have what's going to be called the Art of Discovery. And it's going to be kids only, grades 6 to 12. It'll be the whole community, but it is an anti-stigma event. It's a chance for children to submit pieces of art to be exhibited only. We're not going to sell it because it's not only our patients, but it's to talk about mental health and the journey young people face every day and self-discovery. So we're reaching out to the school districts, and Maggie, I may email you also, because we're trying to get art now, and it will be May 28th through June 13th, assuming Piccolo's still on, because at this point it is. But I think it'll be a different twist, and hopefully if we can keep doing this, I was thinking we could have maybe kids playing flutes or even reading poetry or things, a lot of different things. But so we're looking for art basically, and I know we're reaching out to a lot of the different schools, and NAMI's got a lot of contacts, but I'll give you more information about it. And I sent Paul the flyer for it, and Paul, if you wouldn't mind sending it out to the group, I think it'll be an interesting twist and something exciting, and so we can hear the voice of our kids.
Very good. Very good. All right.
And that's all I had.
I just want to introduce Holly Cutt. She's with the school district, and she does the health and wellness programs. Is that correct?
That is correct. I'll introduce myself. I know some of you are already on here, but I'm the instructional specialist for health and physical education for the whole district. So I oversee all 86 schools and the health and PE teachers in those schools, but I'm also the coordinator for the school wellness and work closely with Courtney, who now will be Courtney for a little bit while she's off to the Health Alliance generation. But I also serve on the education committee for the Act Force drug and substance abuse with Judge Hendricks. So that's a big part of our curriculum as well. And I'm also the facilitator for the district's health advisory board, which basically oversees all of our sexual education programs, but we've branched out and we're now entering into mental health and the drug abuse prevention as well. And that's something that they wanted to do. And lastly, I'm also the president of SCAFORD, which is the South Carolina Alliance for Health and Physical Education. So hopefully I can be somewhat of a part of this committee and continue the great work that you guys are doing within the schools and the community.
Very good. Thank you, Holly.
Holly is our new revised old Dave Spurlock. Dave started that position and Holly has taken it and grown it. But we did love Dave, and now we're glad to have Holly as a part of it as well too.
And Holly's also engaging with the Charleston Healthy Business Challenge as well. So
the only thing I don't do is athletics. Dave did that, but I don't. We have that separate now. It's just one duty we can knock off that makes the job a little bit easier.
All right. Anything else? Paul, do you have anything else? No. Anybody else have anything before we adjourn? Well, I do want to say thank you again. All of you make a great big difference, and you really help the city of Charleston. We appreciate your time, your expertise, and all of your opinions and suggestions. And just want to let you know how much you're appreciated. So thank you on behalf of the city and city council and the mayor and everyone else. We really appreciate it. So if there's nothing else, I'll call this meeting adjourned. Thank you so much.
Thank you, Mr.
Thanks,
Chairman.